Jamie Webber, Brighton Sports Therapy here. I wanted to talk to you today about my thoughts on joint replacements, hip and knee are the most common that we see. And I think if we start from the base premise as to what's actually causing the pain, we can work forwards from there. Traditionally, we talk about the joint surfaces, the cartilage on those joint surfaces, kind of here and here, being worn down as a predictor of pain and a cause of pain. This is what the X-rays will pick up. And a more modern thought is that it isn't necessarily the case that that's where the pain is coming from. In terms of a lot of studies have been done to suggest that this isn't the case. Thought is more that it's actually the joint capsule, which is the kind of the soft tissue around the joint, that actually causes the pain. And that would make more sense to me, because actually what we call more pain receptors in this soft tissue around the joint than actually inside the joint in the cartilage themselves. And that explains what we see at the clinic as well, where we see people who've been written off with various forms of arthritis. We realign them with our techniques that we use, and all of a sudden we see changes in their pain and their function. Now, we're not claiming to be Jesus here, and we can't do this for everyone, but it is something that we see quite consistently. So going back to the joint replacement idea, is it something that we'd condone or recommend? And I'd say it's entirely on an individual basis. I'd say if you're considering a joint replacement, by all means try absolutely everything you can other than a joint replacement before you go under the knife and actually have one. Hope you find that useful. More than happy to talk that through with you on an individual basis if you contact us via the website brightonsportstherapy.co.uk. Thanks very much.